You're watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. With us, we have an expert on this topic, board-certified periodontist, Dr. Stephen Brown. Dr. Brown, welcome to the program.
Thank you for having me. I'm glad to be back.
Good. Now, you really believe that? Like nobody should be wearing a loose-fitting denture?
Absolutely. In this day and age, there's no excuse for anybody to have to take their teeth out at night, to have to clean the teeth out of their mouth, or not to be able to function well. But most importantly, they need to be able to smile and love life.
Okay, good. Now, we've had you on the program before. I think probably 7, 8 years ago or something like that. It seems like that.
Twice before.
So this is all you do, though. I mean, every single day, you're helping people.
Absolutely. One way or the other. We're treating periodontal disease in our practice. We try to do it in a non-invasive way with lasers. And for those people who are missing teeth, we want to replace them with something that they can smile, eat, enjoy their life, be able to function, be able to smile, be with it.
Now, you're in Philadelphia.
Yes.
Are there a lot of people in Philadelphia either headed to a denture or wearing a denture?
There's something like 40 million people in the U.S. who are edentulous. That's 15% of the entire population of the U.S. In Philadelphia, if we were to line them up, we could put them in Veterans Stadium where the Eagles play
Really?
football and fill it up.
So there's that many people. Well, if dental implants, and I've asked you this before, but if it's so good, why aren't they all doing it? Why aren't the denture wearers coming in, I guess, to get teeth attached to implants?
There's multiple reasons.
What's your take? Yeah.
Multiple reasons. Number one, once somebody loses their teeth, they're out of the dental world. They come to see the dentist maybe once every 5 to 7 years. And that's just to clear up a sore spot or, have their denture ground. They're no longer seeing the dentist. So they often don't know what's available because they've come to be able to adapt to what they're using. They adapt to the situation. They learn to function with what they have, and they don't know what else is out there. Oftentimes, they are fearful of coming to the dentist. They've had a terrible history. Let me tell you what life is like on the way to dentures.
Okay.
You go to the dentist on a regular basis. You have fillings, you have caps, you have extractions, you have root canals. All of those things are on the staircase to failure. It's a snowball of expensive events over the course of years that leads one down the road to losing their teeth. You don't want to go to the dentist anymore. In fact, when your teeth are removed, you're often relieved.
You're done. I told you this. My father, when he got his teeth out, he said he was happy because it was over, all the hassle.
All the pain, all the expense, all the bad breath, all the not wanting to smile, all the spaces between your teeth. All of a sudden, you've got, if they don't fit very well, they're at least good looking.
Yeah.
And the problem is that living that way is not great, but oftentimes you don't realize it.
Now, you told me it's hard to get the denture wearers in because they've adapted. Elaborate on that.
Well, the fact of the matter is they don't know what's available to them. They don't know that there are many options. Well, here's the thing. Dentures are not attached to anything, so they're floating in the mouth. The upper dentures are plastic, and you can't taste food. You don't have the feeling of a nice, warm, hot cup of coffee. And lower dentures are even worse. The lower dentures just are flying out of the mouth because the tongue and the cheeks and the lips want to push them there. Let me tell you a story about this. And actually, these are two stories that hit close to home. My father had a partial denture. It was replacing quite a few teeth. He didn't have that many teeth left. He never wore the denture. It was always in his back pocket.
Wow.
And it used to drive my mother absolutely crazy. And she would say, Bernie, put the teeth in, as they were going out socially. And he was always uncomfortable. Another story close to home. My wife's grandmother, she told her that on a routine basis, when she would go to bed, She would have a cup of water under the bed on the left of her bed. And she would put it in right before she got under the covers at night so her husband wouldn't know that she was wearing dentures. That's not an unusual story.
So they are embarrassed of their denture.
Yes.
They tell you this.
People tell you that they are embarrassed with their denture, but they often don't say it because they've adjusted to it.
Now, I know denture wearers. I think we've talked about this. And they seem to be fine. They don't complain at all.
They don't complain.
Now, some people are happy denture wearers, or you're saying there's really no such thing as a happy
I don't really think there's any such thing as a happy denture wearer. A denture wearer has become adjusted to wearing the dentures. They don't know that there's an out. Frequently, they've self-diagnosed themselves out of the world because they think they don't have enough bone. They think maybe you need one implant for every tooth that's missing. They think that they aren't healthy enough. It's not a possibility for them because they've been told by dentists, and this is the sad thing, they've been told by dentists on a regular basis that they can't have them. Let me tell you.
But isn't it true? I mean, if you've been wearing a denture for like 20 or 30 years, you don't have enough bone to do this.
Not so. And even if they don't have enough bone, we can create the bone. Look, if they can walk, if they can crawl, if they can hobble into my office, we can do something.
You can work
for
with them.
Absolutely can work with them.
How old can you be to get this done?
Well, I'll tell you that I have done several patients in their mid-90s.
But at 90 years old, I mean, why would they want to do this or go through that?
They would like to be the same as you, Randy. They would like to be able to eat, and I'm not talking just about any old food. They want peanut brittle. They want ribs.
All right.
They don't want to just be eating the high carbohydrate diet that they were eating with smashed potatoes. They want to be able to go out with their friends. They want to be able to get those hard candies that they get at Christmas time.
So you can eat whatever you want with a fixed set of teeth that you give them?
Absolutely. There is no difference.
A carrot with their front teeth? I mean, raw?
Not only carrots, they can eat nuts, they can eat apples, anything. Corn on the cob, the things that people say you can't eat, absolutely can eat. There is no difference in the degree of function that a patient has with implants than with their natural teeth when they had them. It's just a shame that more people don't know about this, that more people aren't told about it, that the dental profession is failing them in so many ways because there is an assumption that they may be too old or don't have enough money or any number of reasons why it's fearful that it might be very painful to have this done. Let me tell you about that. The fact of the matter is that there are no nerves in bone. So if we have to make a little penetration in order to put an implant in, there's no pain.
So that part doesn't hurt?
Doesn't hurt.
So the gums are what's sore?
The gums aren't sore at all. You may have a little bit of discomfort after the procedure, but during the procedure, Novocaine. You don't have to go to sleep. You don't have to go to a hospital. This can be done in our offices. On a routine basis, we do this.
Is this true, by the way, that on the day of the procedure, people could literally walk in without teeth and walk out with a full arch of teeth? They don't come in and out?
With the technology that we have today, the high technology that we have, and working with great restorative dentists and with great laboratories, literally a patient can walk in the office and leave that day with a full set of teeth.
How soon can they eat?
They can eat the next day. And it takes a couple of days to get used to the idea that they have teeth. It's only because they didn't have teeth, and now they have to get used to the idea that their mouth is the way it's supposed to be. So it takes a slight adjustment, but they can eat the next day.
Now, we should mention, you're a specialist, a periodontist. You, I guess, lecture on this topic. You teach other dentists this topic. You have work at Temple University. Why don't you tell me a little bit about your background?
Well, I've been involved in teaching for a long time. I teach in 3 different places. I'm professor of periodontics at the University of Pennsylvania. I'm professor of periodontics at Temple University, and I'm the director of the Implant Center at Albert Einstein Hospital. In each of those places, we have 25 residents at Penn, a dozen at Temple, and 10 at Albert Einstein. And it keeps me in the game because they challenge me on a regular basis. There's nobody smarter than young residents just out of dental school.
So is that the future of dentistry? Like these young guys that you're teaching in their 30s, When they're in their 60s, do you think dentures as we know them today will not exist, possibly? They'll all be attached?
I would hope that that would be the case. As a matter of fact, I've been around dental implants since the mid-'80s. It took me that long to get to this point. These young people are coming out of school with the tools. And when they graduate from dental school and they go into specialty programs, most of the periodontal specialty programs that I'm aware of are heavily influenced by the potential that dental implants give to people.
You're a specialist. You teach other doctors. You've done thousands of these. You're a key thought leader when it comes to dental implants. And people need to know, I'm not siding with you. I'm just stating the facts on your bio. But does it cost more to go to a guy at your level?
It really doesn't cost more to go to somebody. But what you need to find out before you go to anybody is, are they doing the diagnosis and treatment planning with the appropriate methodology so that they're doing this in a safe way. For instance, we used to do this with regular x-rays. Now everybody gets a cone beam CAT scan. If your dentist isn't using a cone beam CAT scan to give a three-dimensional picture of where all of the structures are that you wouldn't want to be next to with an implant, then you got to run, not walk to somebody else.
Is that right?
Yes. And today we have the technology to build bone, so we can build the bone where we need it, and we have specialized implants to fit specialized problems. So today, the opportunities are endless.
So really nobody should be wearing a denture?
I absolutely believe that nobody should be wearing a denture. And quite frankly, if they knew how easy it was to have something better, I'm telling you, there aren't enough good people in the United States that could take care of them.
There'd be lines.
They'd be lining up.
If they knew how good it was. Is this one of those things where they say I should have done this years ago?
Almost everybody that has multiple implants and gets rid of a floppy denture, something that they really hated but have lived with, they wouldn't do it any other way.
But what about the other group of people that are getting dental implants? The people that their teeth are falling out. That means they're headed to dentures. They have bad gums, bleeding, etc. I guess what I'm asking, are their gums too bad to hold the implants? Are they also candidates or no?
As a periodontist, I'm uniquely qualified to answer that question. When they have the inflammatory response, when there's infections around their teeth, the best thing you can do for them is to remove those teeth. When the teeth are removed, the source of infection is removed. Consequently, the gums heal, the bone heals, and now we're ready to do something better. We can give them something that's preferable for sure over what they had before.
Now you use a laser.
I do.
And we've had you on the program talking about this newest laser. And I remember when I first met you, because a lot of people say, I don't know about that laser. I don't know about Dr. Steve Brown. And now they've pretty much adopted, this is mainstream. This is the new trend. So how are you using it with the implants? Is it mostly on the extractions? Or are you cleaning up, disinfecting the area?
Okay, the beauty about the laser, periodontal disease is an infection. It's caused by bacteria that we can identify. The key thing about the laser is that laser light energy is attracted to colors. And the bacteria that cause gum disease, that cause the people to lose their teeth, are red, yellow, orange, and black. Consequently, we can treat the gums prior to removal of the teeth if the teeth are hopeless. Or, if they're not hopeless, we can save the teeth. But we're talking about implants here, and we would not want to take infected teeth out and just not treat the area, so that it's going to be the most rapid healing will occur if we've gotten rid of most of the infection.
So if you're going to do this, look for a dentist or a periodontist specialist with a laser.
You know, it's not even just the laser. You want to look for somebody who has experience doing these things. And you, as the patient, should be asking us.
We're going to take a quick break. We come back. I know you brought some photos, so we'll get to the photos. We come back more a little bit about the process and how you determine whether somebody could even do this. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
If you're losing your teeth, get the implants. Don't get, I had the partial, I couldn't stand it.
Yeah.
You know, implants, they're wonderful. The best investment I ever made.
Recently had an implant done, and it was very easy. If you're thinking about it, do it. There's no, it just works. It's fine. There's no difficulty at all with it. And I'm getting it done so that I will be able to eat mistake when I retire in a year and a half. Take my word for it, it doesn't hurt. Get it done.
You're watching the Wellness Hour. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. With us we have Philadelphia's go-to dental implant periodontist, Dr. Stephen Brown. Dr. Brown, welcome back to the program.
Thank you.
Now, so if everything works out, give me the timeline. And of course, in a perfect world, somebody calls today, goes in for an exam, whatever. How soon can they have their permanent teeth that don't come in and out?
If they're watching us today, hearing about this, and they come in tomorrow, for sure, within a month, 2 at most, they can have just about any type of restoration on implants.
Meaning what? They can have
Meaning
teeth.
secure teeth, not teeth that come in and out. And it doesn't matter what age they are either. I'd like to show you a picture of a patient that I did not too long ago. His name is Joe. Joe came to me, 93 years old. He said, I've been trying to get fixed teeth. I've been wearing dentures. I don't want to wear them any longer. I've been to a dozen dentists. Nobody will take me on, either because they can't do what I want them to do, or they think I'm too old or infirm. This guy was as healthy as you can imagine. We were able, in a very short period of time, to place his implants, and you can't imagine what he's like. We don't think that people that age, today, 80 is the 60.
Yeah.
And 90 is the 65. The fact is that we see lots of patients like that. The vast majority of patients that we see who've lost their teeth are older. And one of the reasons they're older is they didn't know they could do this sooner. If they knew that they could do it sooner, they would have done it.
He's on a video of yours, is that right?
He's
kind of singing about it, you said.
He literally, when you asked him how it went, he starts to sing. And it's one of the things that makes me want to come to work in the morning. It's one of the things that makes me want to tell these stories to my residents and sometimes have them come to the office and see what we're doing, because I'm so proud of what we're able to do for people today.
Now, we're short on time, but if somebody's watching this, okay, maybe they need all of their teeth extracted or their denture on the consult. Obviously, you go through the medical history, et cetera, but what are their options for when it comes to dental implants?
If they're wearing dentures already, 2 implants on the lower jaw or 2 implants on the upper jaw sometimes is enough for somebody to get a more secure denture. But
like a snap in, snap out?
Snap in, snap out. And at least the denture is now supported by the dental implants. The problem with the 2 implants or the 4 implants on the upper is that people have to be adjusted to these. And as the adjustment process occurs, sometimes they start to loosen up. The dentures have to be adjusted again. It's an ongoing process.
So you're not a big fan of the snap in, snap out?
I'm a big fan of it if that's what the only thing that patient can have for many reasons. It is so much better than dentures that I even like those. But if I have my druthers, if a person can have fixed, permanent, non-removable, functional, beautiful teeth, you don't get a second chance to make a first impression. And these people, they're smiling, and that smile is coming from the heart. They're feeling energy again. They're feeling their mojo again. They're feeling younger again.
Just because of their teeth? I'm saying it
Absolutely.
respectfully. I mean, look, you're a periodontist. You probably think the smile is like the most important thing.
Indeed it is. If you go around the world, it doesn't matter what country you're in, if you smile, people smile back at you. They know you're friendly. And the fact is also that they have had many, many studies in a variety of journals and periodicals that have shown that the single most important thing that people see when they meet you is your smile.
Yeah.
I mean, if you are smiling, people are attracted to you.
It's like charisma. It defines your charisma.
Absolutely.
We talked about this, even presidents, like Jimmy Carter, they said because of his smile, he won the presidency. But the opposite's true. We all know politicians that were duds just because they couldn't talk and smile.
I will tell you that often when somebody is not smiling, when they feel bad about themselves, when they feel they're not whole, they don't do well in job interviews, they don't do well in promotions. I had this one patient, His name was Colonel Frisbee. He was a lieutenant colonel in the Army. Just in the year before he got out, he finally decided to have something done about it. We were able to give him fixed upper and lower teeth. During that period of time, he was promoted to full bird colonel. But more importantly, when he came out, he had wanted to work with the youth of Philadelphia, troubled youth. And because he now had the confidence to be in front of groups, to speak and guide these youngsters, he was a new person. And things that he was unable to do when he was in the military.
Did they look real, by the way? Did the teeth look real, or can you spot them?
You cannot spot them. With the laboratories that we have working today and the ability to do these things with new materials, they're just absolutely natural. And you would not know if you lined up 10 people and 8 of them had dentures and 2 of them had natural teeth, you wouldn't know the difference if those dentures were secured with implants. Or the teeth were secured. I shouldn't even say dentures. They're not dentures. They're fixed, permanent, non-removable, bright, shiny, smiling teeth, just like you would want.
Okay, good, good. Now, another thing which is very surprising, you say that there are married couples where one of them has a denture and claims the other one doesn't even know that they have a denture. How can that be?
I told you the story about my wife's grandmother. The fact is, people don't want you to know. If you're out in public, often they'll go to the bathroom in order to clean the dentures so that they can sit at the table with friends and their friends don't know it. People who are married frequently run to the bathroom, clean the dentures so that their spouse really doesn't know what's going on. And there are people I know who've been married for years and their spouse doesn't know they're wearing dentures. So this is something that is life-altering.
The challenge is just getting people to come in.
Exactly.
Because nobody likes going to the dentist, especially the periodontists, right? Because they feel like they're in trouble when they're at the specialist.
They run for cover when they're told that they've got to go to the periodontist because the reputation is that they're going to have surgery done in their mouths. We can do something completely different with a laser. You don't have to have traditional surgery. Non-invasive techniques, maybe that's what we ought to be talking about. Implants today are non-invasive. Periodontal therapy today is non-invasive. In medicine, you're doing arthroscopic surgery. It's non-invasive. This is the direction that all of medicine is going in. Why shouldn't we be doing the same thing in dentistry? It's too late in the day for us not to be on board with the latest technology. And that's the other thing. If you're looking for somebody to do this, besides asking them the questions about their training and whether or not they've got good imaging technology, you want to make sure that they have the best and the latest techniques that are available.
Okay, good. Now, do they need a referral to see you?
They don't.
Because you're the specialist. They could go to you directly first.
They could go to me directly. I like working with other dentists as a team, but they can go to me directly. In fact, the vast majority of the patients who come to me because my reputation as a teacher, educator, and clinician.
Now, if they already have a dentist that they love and they're wearing a denture or whatever, they could keep their dentist and still get a full arch of teeth. You work as a team.
We work as a team all the time. And the team is a triad. The surgeon, the dentist, and the laboratory. Put that together, the best of the best, you've got something very special.
Okay, good. I know you have one more photo, and I know you wanted to show that.
Let me tell you how transformational dental implants can really be. This lady was missing some teeth. She'd waited for years in order to do something about it. She educated her children, and it now was her turn in life to have this done. She came in, we were able to put implants in, and it literally changed who she was. Have a look at this picture, and you will see a different person.
Wow, very nice.
She is a new person, smiling, vibrant, changed her hairdo, changed her look, and she was a beautiful person before, but she's now a really beautiful person. And you can see it. She feels she's beautiful. It's from the inside out, all because of what we were able to do for her in her mouth.
Now, we should mention, because we're out of time, but Medicare, Medicaid does not cover this. Even if you have the best PPO insurance, does not cover the whole cost of dental implants.
That's true. But you know what? It really isn't the issue, because if somebody wants something, we can make it happen for them. We have a person in our office whose a dedicated job is to find ways that people can afford things. We can create financial arrangements that people can live with. We can create budgets over time that people can live with. Or it is also possible to stage treatment. Do a little of it now, a little bit later, and then we can put it all together and finish it at the same time.
Okay.
The end result is what it's all about. Absolutely, the end result is what it's all about. We can make it happen.
We're out of time, and I appreciate this info. They could, I guess, go to your website, learn more about this. But final message to the person that I guess they're headed to dentures. They probably know it, maybe. They have bad teeth. Or the denture wearer. But let's say they're still afraid. They still are skeptical. They're worried about pain. They're worried about whatever. What do you say to them?
Come in, let us talk to you, and I promise you, you will go out knowing A, that it can be done, and B, that it can be paid for.
You're passionate about this.
I am very...
I mean, why do you like it so much? I mean, I say that, respectfully, but this whole implant thing, I mean, because we've talked, and you're one of the guys that's like, lecturing across the country on it.
I'm passionate because I have learned over the years what it is possible to change people's lives. We used to think that what we did was put fillings in teeth or extract teeth. We're giving people new lives. We're giving them a future of promise, a future of being able to face the world with a smile that comes from the heart.
Nice, very nice. Dr. Brown, I want to thank you for coming on the show. Always a pleasure, and thanks for coming out. And we'll have to have you back. We'll figure out a topic for you. So thanks again.
All right.
You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.